And now we can have some fun for some questions and answers. How are we going to work this with so many people here? I guess we don't have a mic up in there. Somebody come to a mic and form a line. Oh, well, nobody's raising their hand except you, so great. Let's go with your question.
What about the FDA or the feds and their recommendations for balanced diet? Do you talk to them, or why is it that they're coming out with what they come out with? What's the deal?
I don't know. For those of you who couldn't hear that, they said, what about the FDA coming out with a balance? In other words, he's saying, how come how come the governmental and health authorities don't recognize this information and don't make more aggressive change than what they're recommending to people? Is that what you're asking me?
The Surgeon General.
Like the Surgeon General, that overweight, junk food eating Surgeon General. Because people basically make decisions based on emotions and feelings, and you have political pressure and economic pressure, and and social factors affect what people. What you're saying to me is, how come you're one of the few people who can go against the tide and just say what the evidence shows and not be influenced by bias and what people want to hear, what people want to eat, what people want to do, right? And it's, there's more and more people who are thinking the way I am, and more physicians, and more nutritional scientists that are on board right in the same place I am. And I used to be alone with these ideas, and I'm not anymore. You'd be amazed at the growing amount of people that are coming right on the back, and the contact I get from scientists, government officials, even the senator from the representative from Louisiana, which is the most obese, heart attack-ridden state in the country, speaking to me, said that we got to get you to Louisiana. We got to change the way people are eating. We know you saved my father's life. Stuff like that. So it's getting out there. It's just a slow process with a lot of political opposition. Yeah. Yes.
Is there any studies being done? I heard you talk about fat-based drugs. Is there any studies being done on the vegetarian type diet on people who have eating blood pumps or anything like that in the impact body?
The question is about impacting clotting, blood clotting, on a nutritarian diet. Well, obviously, yes. I mean, the question was, are studies being done? I'm the head of a nonprofit organization called the Nutritional Research Foundation. You can access that website at nutritionalresearch.org. I certainly welcome people to, if you use Amazon Smile, you can actually use your search engines, and it can donate money for nutritional research. I'd love to do a nutritional research project on that, but we don't have a nutritional research project planned on that because we have other things that are more prioritized in the list. And we want to do a breast cancer study, want to do the Nutritarian health study, want to do we're doing some other studies first, obviously. And no, there's not much studies being done on this, but I'm working very hard to produce studies. I just finished I'm involved in 4 studies right now where we surveyed 2,300 people following a Nutritarian diet. 2,000 people in the study with outcomes, cardiovascular outcomes, and so I've got it. But of course, it decreases the risk of throwing a clot. But I don't have the studies to document to the extent and that proof. But we're talking about a person who would be on an American diet, switching over to a Nutritarian diet, and how effective that would be. It's very, very effective. But I don't have a study on that. No. Yes.
Can I get your take on plant-based protein powder?
Yes. The question is about plant-based protein powder. And I have to say that the more the protein powder is biologically complete, that would mean like a isolated soy protein powder would be not recommended because that would have the potential to raise IGF-1 like an animal product would. But if you used a pea protein or a hemp seed, what I recommend people do, or athletes who want to use extra protein, is use ground hemp seeds, sunflower seeds, Mediterranean pine nuts. And if you want to use a protein powder, use like a pea hemp protein. Don't use an isolated soy protein. OK? All right. Next question. Yes.
The controversy in Oregon right now is genetically modified foods, and there's something that's coming up for election
Are you able to vote on it?
Yeah.
A genetically modified food?
Yeah. Does that affect nutrition, phytochemicals, that sort of thing?
Yes, it would affect nutrition because what commercial growers do is they're not organic growers. Organic growers means that you don't just not use pesticides on the food as much, you also support the health of the soil, and you have more insects and bacteria and fungi, so you have more natural micronutrients in the soil where the plants are grown. So we're supporting organic farming because it's certainly better for us, but it's better for the insects, it's better for the soil, it's better for future generations, it's better for polluting our environment, it's better for the workers working with the chemicals too. You know, the people who have to work in the farms are going to get cancer. So it benefits all people to use less chemicals in our growing of crops. Yes?
Is there any research done on some syndromes like Marfan, and if it's slow, maybe not?
Well, there's research to suggest that the way the mother's diet, the diet of the mother, and the father too, but mostly the mother, not just her diet during pregnancy, we're now recognizing that the mother's diet years before conception affects the health of their baby and increases the risk of genetic defects. Let me say that one more time. That the lack of green vegetables in the mother's diet affects the risk of their child's risk of childhood cancer. And the number one cause of death in children, non-accidental death, is acute blastocytic leukemia, linked to the lack of consumption of vegetables, not just during pregnancy, but in years prior to conception. So that the use of folic acid to supplement women to prevent birth defects gives women the idea that they can use a pill to get their folate, because folate is not from folate is from green vegetables. Folic acid is synthetic, it's from petroleum. It doesn't have the same effect as folate. And when you take your folate from green vegetables, you get a host of other nutrients that come along with it and for the ride. So by doctors prescribing a pill that absolve women of the necessity to eat green vegetables is dramatically heightening the risk of childhood cancers and other problems, because folic acid itself is linked to breast cancer, respiratory infections, increased asthma and allergies in children. We have to go back to the basics, and that is there's no substitute for green vegetables, because it'll decrease birth defects, childhood cancer, and all the other, you know what I'm, so it's getting back, and you can't wait till you're pregnant to try to take the right things. You have to do it before you get pregnant, because the egg that creates your babies are living in the mother's body before she even conceives. How long is that egg living in your body before you conceive, do you think? Since birth. Well, actually, it was formed in the second month of your mother's pregnancy, so it's actually about 7 months before birth that egg was placed there. The egg was formed in you. So the eggs of your children are there your whole life. And you protecting that habitat and keeping it healthy your whole life protects the health of your children from having birth defects. Okay, yes?
Nuts and seeds, do you just advocate raw, or do you think roasted is fine? What's your comment?
I do advocate raw, but I recognize the studies that show that lightly toasting or roasting nuts doesn't hurt their biochemical benefits. In fact, some studies show that when you lightly toast, it actually enhances the absorption of some of those nutrients. So with time, I'm changing my fear of using things that are lightly toasted. So I'm okay now with toasting a little sesame seeds or almonds, lightly toasting them to give them more flavor. Because I'm not overly toasting them, making them dark brown and like ruining them. I'm just giving them a little extra flavor by lightly toasting them. And I'm not so fearful of doing that because the studies show they're still beneficial.
So roasted and salted?
Yeah, I'm not going to have conventionally roasted and salt because they over-roast them and then they put salt, because, you know. Yes?
So you don't really like potatoes all that much. You mentioned the potato with beans. Does that slow down the insulin rush that you get from eating?
Yes, when you eat something with beans, so that's correct. That when you're eating something like potatoes with a meal with greens and onions and beans, you're going to lessen the glycemic effects of having the potato without the beans and the greens, right? So that's right. And of course, if you're thin, I don't have to be afraid of eating potatoes because I don't eat much potatoes anyway, and I'm exercising a lot and I'm slim. But if you were overweight and more sedentary, then you have to be more concerned about that. So proportional to your, and I also don't eat a lot of potatoes because I want to eat more of the beans and more of the healthier foods anyway, the higher nutrient foods. But I'm still not going to not eat any potato, but I make a delicious dish. It's called cauliflower mashed potato, and there's no potato in it. It's made with cauliflower, a little chopped spinach, and a little cashew butter, and soy milk, and it's so delicious. It's really, you got to try this cauliflower mashed potato. Yes?
I have a question in regards to allergies. I myself suffer from allergies, and a lot of the vegan lifestyle is around a complete spectrum of vegetables. So when you have allergies that limit you to certain, does that run a risk then of not getting the total Nutritarian lifestyle?
No, her question was about She has certain allergies limiting some foods she can eat, and you got to do the best you can. But what I'm saying here is that when you focus your diet on nutritional quality, like a Nutritarian diet does, even with the elimination of certain foods you can't eat, and we give people with allergies a little extra of certain fats that help their immune system not be so hyperreactive, and we give them probiotics too. High-dose probiotic, we give them GLA, which is from borage seed oil or blackcurrant seed oil, and a little bit more omega-3. And after 2 years on the program, we can challenge them with homeopathic amounts of what they have the mildest allergies to, and over time we can actually reduce the risk of their allergies. So I think you're in the right place, and we can start to make you less allergic with time as your health gets healthier. And asthma and allergies are linked to the use of antibiotics in young in life, which destroys the gut lining, and the lack of green vegetables, which prevents the development of the interstitial lymphocytes that line the digestive tract, the villi in the digestive tract. So if your children, the whole key is to green vegetables and staying away from doctors. And that's right, because when you live in a healthy manner, you don't need much medical care. You don't need much doctoring. Like my 4 kids never took an antibiotic, never had infections, never had all these being sick all the time, never missed school, never had, one kid got chicken pox, one kid got something else, but it was rare, like once or twice in their whole years of schooling did they ever have anything wrong with them, and even then they wouldn't need an antibiotic. But what happens so often is that very first infection in the first year of life, which is viral, that you bring your kid to the pediatrician puts them on amoxicillin, and there you go, risk of allergies and asthma just from that first drug, which they didn't need, which was viral to begin with, had a little red ear, should have done nothing, taken the antibiotic, and now he's more tuned to having more bacterial infections in the future because you destroyed the bacteria in the digestive tract, and you selected out for more powerful bacteria. Already you start the cycle of more vicious, making you more medically dependent. Okay, yes?
Do you have additional recommendations for those folks with autoimmune issues or arthritis?
Yes. The question is about with autoimmune disease, like rheumatoid arthritis, ulcerative colitis. I have newsletters on the website which has my protocol for those with autoimmune disease, and the one for ulcerative colitis and Crohn's is different from regular autoimmune disease, because there are different things I recommend, and the diet is different as well. So if you have a serious illness like that, go to drfuhrman.com, become a member, and search on the protocols and newsletters, and you ask questions, and get even a kidney failure. We have diets designed for kidney failure and protocols for various issues, serious medical problems, to help doctors and to help people tweak the program for their particular condition. Yes, way in the back with your hand up. We'll get some people way in the back. Okay, yes.
What about fatty liver? You talk about taking different oils and things. How does that affect the fatty liver? And they say don't drink any alcohol, literally abstain from alcohol. That's fine. But if you have a fatty liver, they're saying that the only thing to reduce that is to lose weight.
Yes, of course.
What? No, so, is there other things?
Are you talking about yourself?
Yes.
Oh, sorry. So I guess most of you get that question. She has some degree of fatty liver, and she's losing weight. It's not going away. And of course, if she's got alcohol, many of you should be aware, thank you for that question, by the way, is that people aren't aware that 1 glass of red wine a night, one glass of red wine, is a significant risk factor for breast cancer. It increased risk of breast cancer by 12%. There's studies done all over the place that show that even a limited amount of alcohol increases risk of breast cancer 10 to 15%. That's a significant risk. Yet you're drugging into your head that alcohol is better for your heart because that's like aspirin is in the blood. Well, we don't need blood thinners when we're eating right anyway. And aspirin increases risk of macular degeneration and other problems. We want to live in a manner to avoid the need for medicinal substances. Now, to get to your question, is that I would put you on the in-body, those things that measure your body fat and your visceral fat, and keep you going in the right direction on this program. We're talking about body fat, not dietary fat. And so we're talking about eating a diet that inhibits the storage of fat in the body, and that will improve because we're also talking about the intake of these high nutrients that help the body get rid of body fat. The diet, so we're talking about the quality of the whole diet, and this is the perfect program for you to reverse your fatty liver. And you have, obviously, the fact that you didn't lose weight already. I'm not close enough to you to pinch you to see if you're still fat or more. Too much fat in your body. I can't see that anymore. Oh, great. How much do you weigh now? oil, the olive oil, saying, with a belly fat, that belly hanging over that waist, saying, don't worry, it's the good fat. So obviously, you still have too much fat on your body, and you've lost 40 pounds, you're doing great, your liver's going to clear up, just keep going. You know, so, yes?
Coffee. Where do you stand? Coffee is a plant-based product.
You know, for some Americans, the only phenols, the only beans they eat is coffee. The only thing they get any phenols in their whole diet. You know, which distorts the literature, distorts the benefit, because people, when they test coffee, that's the only phenols they have in their whole diet, it shows that coffee has a beneficial effect. If you get coffee, have that worse. Because they're not eating any beans and other things that have carbs in them. They have no phenol in the berries. So the point is that, but we know that when you look at any population with a high, or study with a high amount of coffee, you have increased your sleep disorders, you have increased risk of cardiac arrhythmias, you have increased morbidity. So the bottom line is that 1 cup of coffee is not dangerous. When people have 3, 4, or 5 cups a day, it becomes more and more dangerous. So the problem is it's addictive, and some people can't just hold off on 1 cup a day. They start having something, they push it. It's like some people say, well, can I eat a little bit of that? Can I eat a little bit of that? For some people, having a little bit drives them to eat more. You know, so you got to be careful if you want to know. My father was a person who was a coffee addict, and he couldn't stop drinking, you know, he wanted to stop drinking coffee, he had a lot of trouble stopping his coffee habit. But, yes? Okay, with that thing, well, okay.
I'm questioning about the omega-3s. There's a study on the vegans, and their omega-3 levels were low, the percentage of them. But how does that compare to the general population, you know, of meat eaters and everyone when their levels are low as well?
It depends on whether you're comparing a fish-eating population or a non-fish-eating population.
Repeat the question.
The question is, in the study I showed with 166 vegans whose level of omega, DPA, and DHA were low, how does that compare to the non-vegan population's level of omega-3? And my answer was, it would be comparable to the non-vegan population who were not supplementing and not eating fish, but it wouldn't be as good or high as the non-vegan population who regularly ate something made of fish or supplement with fish oil. Right? Next question. Somebody right here front, how about you?
I'm a 3-minute student, and I'm looking at going to general physician because I feel like we can heal our population through food and through nutrition. But my issue is, from your point of view, how you go against the status quo of how medicine is being taught, and that we are focusing more on medication than we are on nutrition, and how nutrition is going to be part of dental education nowadays.
The question is, a student going to medical school in the near future, and how do I deal with, did I deal when I went to medical school, or how does your deal with the people, the medical orientation of the profession, and the fact that they don't teach or ignore nutrition? I have to say that you're going to probably have an easier time than I did, because, and he said he was going to go to medical school because he had such an enthusiasm and desire to use nutrition in his practice. That's why I went to medical school. I didn't go to medical school and become interested in nutrition. I went to medical school because of my interest in nutrition. And when I was in medical school, I can remember walking to my seat in the aisles to get to my seat, and all the other medical students were hiding in the candy bars in their pockets. And I would say, I'm not your mother. You know, because they made, when I went to medical school, I was open about my enthusiasm for nutrition, and the response of the medical profession and the doctors and the professors would say to me, oh yeah, we know you're right. We know you're right, but you can't get people to do that. We know you're right, but people aren't going to listen to you. We know that, especially this one. We know you're right, but you're not going to make a living doing that. That's what they always would say. And I would say then that, you know, first of all, you know, the amount of people that would do it or not is irrelevant. Because you have to give people, if we're going to go for the first to no harm, give people maximum possibility to get well, we have to give them all the information so they can make the choice of what they want to do. If you're going to just give them medication, already paternalistic decide them, but they're not going to do it, you give them the option to have the best outcome. You already decided for them to take the worst outcome because it's easier for you, or you think they're not going to choose the better outcome. If the chance to choose a better outcome with 1 in 100, you should have given them that opportunity, number one, so the argument makes no sense at all. But number two, let's develop the skills and motivation techniques and intellectual ability and testing to get to learn how to get people to change them, to motivate people, to teach them, to encourage them. But let's not just say we don't, say, well, I'm not so good at getting people to be able to change their diets, not need to try. That's what they're saying, right? But you shouldn't have it as tough as I have it tough. I kind of like enjoyed it. I enjoyed the controversy of the markets back then. But now, they made me the keynote speaker at my 25th anniversary to medical school reunion. And all these doctors coming up to me and say, you saved my life. I read your information, you saved my life. This is the medical doctors tell me. They would come to me and say, not only did you save my life personally, help all medical conditions, but also you've rejuvenated my enthusiasm for medicine again. Because I was pretty discouraged with how people weren't getting on with my career. And I'm using it in my practice, and that's great. And I get so much gratitude from other physicians and people, and I have so much. What's amazing, I tell my wife every day, I brag, I say, you wouldn't believe all these doctors who are like doing the program now, like, or fans of mine, like, to writing to me every day and saying to me how much I've changed their lives and their practice. It's really exciting that I'm actually influencing other physicians to change their practices. And so welcome you to do this. Great, it's going to be fun. Okay, yes, you're way back there. Speak a little louder if you can. I got a short, fat, sick, and nearly dead movie.
Yes, and we watched Educated also. We called it a very good film. There's a new movie out called Fed Up. And just curious, if you've seen it in Japan, is there anything about the film that we thought was omitted?
I'm sorry, the question is about the new movie called Fed Up, and I'm sorry, I haven't seen it. Am I in it?
You are in it.
I'm sorry, I didn't see it. I heard of it, but I'll keep it in mind and see it one day. I didn't see it yet, I'm sorry. Yes?
What's the best way for someone to consult with you that's in kind of, very delicate, almost emergency state situation? Is that your website? Or
yes, the pretty much the only way. I do have physicians in my medical practice who you can come and see in person in New Jersey. But the easiest, the cheapest, and simplest way is just become a member of the website, and at the level where you can ask me to participate, you can ask the Dr. Fuhrman, and every day, even today, every day of my life, I go on there and answer people's questions, and so my medical staff, helping people diet and help them to utilize the benefits of their local physician and say, well, maybe ask the physician this, or make this change, or so the Ask the Dr. Forum becomes an educational tool for other people to read the question I answered for you, because I can have 1,000 people reading the question, your answer, and have that as the content of the site, and people enjoy the answers and learn from them. So the best way is just to come on and communicate, join our community, and get the questions answered, and it's fun. Okay, we've got a long arm back there. Oh, that's a woman. Oh, she's standing up. I thought you were the guy behind with the long arm. Right.
As a vegan, my LDL cholesterol has dropped quite a bit, but my HDL is very high, and my doctor wants me to put me on statins. It's not going to happen. How do I drop my HDL?
I think you're got it mixed up. Let me clarify the question. It's the other way around. So, in other words, you're on a vegan diet, and your LDL, the bad cholesterol, dropped, which is good. But the good cholesterol, which is HDL, went too low. Because you said too high. And he wants to put you on a drug to raise it, and you said put you on a drug to lower your HDL. He wants to raise your HDL. Because now it's too low. Correct?
No, one of them is just borderline, and it's too high. And one of them is just low. One of them is fine.
That doesn't make any sense at all. The HDL is a good cholesterol, and you want it to be high. So let me answer the question you didn't ask, okay? If you don't mind. Since your question doesn't make sense, sorry. So if your LDL is favorable, forget about test isn't dependent by a blood test. It's dependent by the quality of your lifestyle and your body weight. If your body weight is favorable, your physical fitness is good, and you're eating right, who cares what your LDL, your cholesterol number anyway? So just take, take that and move forward. Let me ask the question that you didn't ask. Was that some people are saying that they're following healthy diet, their LDH is dropping too low, the doctor wants to give you medication because that's a concern. It's not a concern. Populations worldwide are at the lowest risk of heart attacks, have the lowest HDLs, and because your body doesn't produce snow shovels if you're living in Florida. You know what I'm saying here? You don't need HDL if you don't have atherosclerosis, and your body doesn't make it for no reason, and if you have a low LDL and no atherosclerosis, you don't need to have a high HDL, there's nothing to remove. So you don't have to worry about having a low HDL eating right. Worldwide, the populations with the lowest heart attack risk have low LDLs and very low HDLs that accompany them. But a higher HDL is only an advantage if you're eating a diet that's heart attack promoting, because then you have a lot of bad cholesterol to remove. Yes?
I bought forensics counseling in February, but I bought up antidepressants and now I'm finding that I'm getting depressed again. What supplements do you recommend and how much and what times of the day for depression?
The question is, she wants me to be specific and tell her exactly what to do for depression, as opposed to the general guidelines. If, oh, I don't mind doing that. And how are we doing here for time? Anybody knows when I have to get pulled off the stage with a book? How much more time do I have? 5 minutes? Okay, great. Thank you. So the answer to the question is, number one is early morning light therapy. You want to be exposed to light in the morning at the same time every day. So you stop melatonin secretion, and your body can produce serotonin at the same time every day. You want to go to sleep in a very dark room at the same time each night. So when you get on a schedule, you should use it if it's not nice out or you're in the wintertime, you're not getting enough natural sunlight to go outside and walk at 7 o'clock or 7, 8 in the morning, then you should get a therapeutic light and be working, eating breakfast, or reading the paper in front of the therapeutic light, so you get exposed to bright light morning. That's number one. The light therapy has been shown to be more effective than antidepressant drugs for the major depressive disorder, not just seasonal depressive disorder. Number two, you should be taking at least 500 milligrams a day of EPA, which means if you use the conventional fish oil, but if you're a vegan, you wouldn't want to use fish oil, so if you use the conventional fish oil tablet, that would be about 3 fish oil capsules a day. It doesn't have to take them all at once or with each meal, but if you want to be a vegan, then you have to use the one with the droppers or the pills, which have lower strength. So my liquid one has about 300 milligrams and 250 per, so it's about 400 per dropper fill. So you probably have to take 3 dropperfuls a day, as opposed to if you have depression, which makes it expensive. The problem with using the vegan variety for depression is you want to go to a higher dose, where a purified fish oil becomes less costly. But if you want to stick with a vegan diet, then you should just use the because a person on a vegan diet who doesn't have depression, who just wants to take it nutritively and not therapeutically, doesn't need much at all. I think a little bit. A little bit has been shown to be very effective. Even 200 a day has been shown to normal. All the people with the abnormal levels were normalized with a low dose. You don't need a lot, you just need a little bit. But you should take more, and you should take about 30 milligrams of zinc a day as well. So that means a healthy diet. And if you're still not doing well after a few months, then you can add saffron. It's also an effective supplement for depression and no side effects. You have about 60 milligrams of that as well as the protocol. But the light therapy and exercise, and eating right, and the omega-3 fatty acids, and the zinc should do it for you. A lot of people have like anxiety and depression. With a couple of days of upping their zinc, their anxiety is gone. Okay. You right there in the middle back. Glasses and your hand. Yeah, right there. I was talking about this person with the glasses on top of your head. Yeah.
Thank you.
Sure.
I was wondering if there's a way you went by some of the slides so fast.
I know.
Do you have them on the website or something where we can go back and spend a few moments looking a little bit more? Because it was such good information, and I know you came late. You meant for us to have it all, but I just wondered if there was a way we could see it.
You could get my book out front, which is called The End of Dieting, which has most of this information in it. You know.
The graphs and the information and the different types of like insulin drugs and all the different.
Well, see, what this is, I pulled that from a different book. The one on the drugs for diabetes was from my book, The End of Diabetes.
What did you have for metformin on that? Did Did you have that one on there?
Metformin.
Was it on your slide?
No, metformin was not the drug that's linked to increased morbidity and weight gain. That's one of the safer drugs that does not cause weight gain. It's the glucosinurias, the Amaryl, the ANDI, the glipizide, the glyburide, those kind of medications that are more dangerous than type 2 diabetics. Some of those medications are extremely on the market. They should be an option to being prescribed. And now we so.
Thank you.
Thank you. Sorry I don't have the availability of those slides, but, because some of the information is taken from one book and some was taken from another book. You know what I mean? Okay, yes. And then we'll go to you in the back, way back next, okay?
My husband has AFib, and he got it in high school, and he's been on Atenolol his whole life. He's 42, 41, and the doctors are suggesting surgery. If he just did your diet, could we skip the surgery?
The problem is, you said he's had it since high school.
16.
Yes, it's the age of 16, so that makes it, more unlikely to fix his diet and go away. And I don't know if he needs to have surgery or have to have intervention. He may just be able to eat healthfully and stay at AFib and be fine until he's 100 years old also. They're not going to have a high risk. This is going to be a lower risk of clot anyway. So really healthy and fit, he shouldn't have, of course, I'm not sure. I don't know. It's possible, but I doubt it. Yes, the way back. Talk loudly.
How will your diet help someone who continually suffers from low blood sugar and that?
Well, I don't know the particulars of your case precisely, but 99% of people, and this is not talking about low blood sugar or a person using medication for diabetes pushing their sugar as well. We're talking about a person who's feeling lousy and thinks they're hypoglycemic. And that goes away fast, eating this way. It goes away really fast. Because you stop feeling shaky and weak and headachy, you stop feeling lousy when you stop digesting food. Because those are withdrawal symptoms and detoxification symptoms from an unhealthy diet. So when you start to flood your body with nutrients, you feel well when your sugar is low. You feel great. So this is super effective for that condition. Unbelievably effective for that condition. There could be 1 in 100 cases may have some biological, super low blood sugar due to the tumors, due to insulin or other problems that are not accounted for, but the vast majority of so-called hypoglycemia, this resolves it very rapidly. You're welcome. Okay, yes, in black sugar.
What do you think about something called natural hygiene, the 8-10-10 diet, or high-carb raw veganism?
You asked me 4 questions. Natural hygiene has nothing to do with the 80-10-10 diet. There's completely different things. Doug Graham, the advocate of the 80-10 diet, is a raw foodist who used to be in the natural hygiene movement, but this natural hygiene wasn't based on 80-10-10. 80-10-10 is mostly fruit diet, where they're worried about eating fat, and I think it's a dangerous way to eat. And many people lose their hair, get fungal infections, lose teeth, and don't thrive, even though Doug can thrive on it, some people do. We don't want to advocate a diet where the narrow population can thrive on. It's a mostly fruitarian-based diet. Natural hygiene was originally, that terminology was originally populated by Herbert Shelton, who wrote about 15 different books, and I read all those books and all those newsletters in the early 1960s, and I was a member of the executive board of the American Natural Hygiene Society, very well versed with those opinions and that body of knowledge. And it was great, it way advanced for its time. But fortunately, we have more science today to twist and to treat and to put things in a direction that's more congruent with today's science and food combinations and trying to, not eat this food with that food is no longer, it hasn't held up to scientific scrutiny. So there's a lot of theories there that were disproven over the years, but for the day when it was designed, there was a lot of great information that got people eating health in that right direction. A lot of good stuff there. What was the other part of your question again? I didn't hear.
They're all the same thing. 80-10-10 natural hygiene, high-carb raw veganism.
Oh, it's all the same thing. Yeah. Well, except for I do recommend people eat a lot of raw foods, as you know, but I don't think you're going to get healthier because you're 100% raw, and then you're not eating cooked beans, you're describing yourself with vegetable beans. There's no lifespan or health advantage for being 100% raw over eating a lot of raw foods with some conservatively cooked vegetables. They can always say, if you eat too much cooked foods, your white blood cell counts will rise, but that's eating a lot of cooked foods and the bad cooked foods. When you don't get that stuff from eating a bean dish or a bean soup or a steamed green vegetable.
So you don't get digestive glucocytosis from eating cooked celery?
You don't get
digestive glucocytosis.
That's correct. Matter of fact, it's a good question because let me just clarify that. It's important you guys know this. follow a Nutritarian diet, your white blood cell count drops very low. That's glucose, you get low levels of white blood cells in it from eating this diet. And you go to your doctor and he draws your blood and he finds your white blood cell counts at 3.5, or 2.9, or 3.2, and he says, looks like you might have leukemia or cancer in your bone marrow lives, and I refer you to the hematologist, the oncologist. Let me make this clear right now. You could say to your doctor, you're the one who's got to go to the hematologist, not me. I don't need a bone marrow biopsy, because what I'm telling you is the normal range of 5 to 10 for white blood cell counts is not normal. That's pathological where Americans lie, because Nutritarians, the tens of thousands of Nutritarians I've seen take blood and seen in my member center over the last 25 years, that their normal levels run between 2.5 and 2.3 and 7, not between 5 and 10. So the lower levels are normal, and studies show that you have low rates of cancer and enhanced longevity for lower white blood cell counts. The higher white blood cell counts are more signs of inflammation and more excess inflammation in your body might have some reactive things. So don't let your doctor be concerned about your